Hi, this is Jose, and this is my diagnosis presentation of Placenta Previa. Placenta Previa is the implantation of the placenta over the cervical os. And this is also due to the upper endometrium being not well vascularized, and this condition increases the chance of preterm labor and fetal hypoxia. So there are three classification of placenta previa, and these are based on how much of the placenta is covering the cervical os. So the first one is the complete, meaning the cervical os is completely covered. Partial, meaning the cervical os is partially covered, and marginal, the cervical os is marginally covered, approximately around 2 millimeters of the cervical os is covered. Risk factors of placenta previa. The first one is advanced maternal age. Different textbook says that this age is 35 years old and above. Multiple pregnancies, especially if cesarean sections were done, abortion, prior uterine surgery, and smoking. Pathophysiology of placenta previa. As the pregnancy continues, the lower uterine segment is growing, and there will be disruption of the placental vessels, and then bleeding will occur. Bleeding can be intermittent or continuous, and bleeding also increases during labor due to contractions and dilation. Diagnostic tests and procedures. Prenatal ultrasound. So this is the first imaging done to check for placenta previa, and this is also the most readily available test at a reasonable cost. And on a recent meta-analysis, it was found that MRI has an overall sensitivity and specificity in diagnosing placenta previa. And with all the advancement in medical technology, studies also found that this imaging can help detect placenta and umbilical cord abnormalities. It just not detect, but it also improves the accuracy in looking for prenatal diagnoses of this condition. So the three-dimensional ultrasound and the tomography ultrasound imaging. Management. So the main goal is to plan and to prevent preterm labor. For bleeding management, if there's a minor bleeding, bed rest is sufficient. If there's a major bleeding, it is possible to have blood products replacement, and IV fluids may be necessary to support hemodynamic stability. If there's a severe bleeding, immediate cesarean section is needed. If fetal hypoxia is present, administration of corticosteroid. This is helpful in enhancing the fetal lung development. Management of postpartum bleeding, administration of uterotonic drugs, and also intrauterine balloon are the initial medical treatment. Uterotonic drugs such as oxytocin, methylgonovin, carboprost, and misoprostol are the most used medication to stop bleeding for postpartum patients. And the second line of treatment, interventional radiological techniques, uterine compression sutures, pelvic vessel ligation, and the recombinant activated factor. Um, but of this four treatment, the interventional radiologic techniques and the uterine compression sutures, these have found to have higher success rate in treating postpartum bleeding. And if none of the first and the second line of treatment works, and hysterectomy is the last resort in controlling bleeding to avoid maternal death. And these are my references for my presentation. Thank you, and let me know if there's anything you guys want to add to my presentation. Thank you.